A new report from the Auditor General says Canada was not prepared for the COVID-19 crisis. Not only that, she also found health officials underestimated the threat in its early stages. Here's the federal health minister's response.
Every country, as I said, is going to be reviewing lessons learned, and there will be a full review of the Public Health Agency of Canada and the government's response as a whole. But I can confidently tell you that Dr. Tam and the entire Public Health Agency of Canada knew that this was a health threat to Canadians and knew that we needed to begin our preparations, not just at the federal level, but certainly as a nation. And that is exactly what happened.
Auditor General Karen Hogan joins us from Ottawa. Hi, Ms. Hogan. Good to see you again. Thanks for making the time.
Hi, thanks for having me, Vashi.
I know that you looked at a number of issues, but I want to zone in on the Public Health Agency of Canada because you arrived at a conclusion that it was not as prepared as it could have been for the onset of the pandemic. Can you identify for our audience, if you were like top headlines of what the factors were that led you to that conclusion?
Sure. In our audit on pandemic preparedness and border measures, we actually identified exactly that the Public Health Agency wasn't as prepared as it could have been. And I would highlight four things for you there. There was health and emergency plans that were not up to date. And more importantly, the federal, provincial, and territorial response plan that just hadn't been tested. We saw that longstanding issues related to the surveillance and gathering of health data, as well as the IT infrastructures that support it, had not been addressed in some cases more than a couple of decades. We saw a risk assessment tool that was not designed to address the risk of a pandemic. And then finally, that the Public Health Agency was not prepared or had not even planned for administering a quarantine at the national level across the entire country.
And you mentioned in one of those areas that the warnings had been there to some degree for a number of decades. I'm wondering, when you look at the overall picture, is it justifiable that they were unprepared, given that there had been, in multiple instances, warnings that they needed to be better prepared in the event of maybe not something exactly like what we're experiencing, obviously, but something that could happen like this?
I don't think anyone really could have foreseen or expected what we're living right now, but I think it just underscores the importance of taking the time to invest and putting some value in being prepared. What we saw, the most important issue that was longstanding that hadn't been addressed, was really about health surveillance information and sharing of that across the provinces and territories with the federal government. You need all of that information in order to modify and inform the continuing evolving response to a pandemic. We raised those issues as far back as 1999 and again in 2002 and in 2008. The agency themselves had identified it as lessons learned following H1N1 and SARS, and even a Senate Standing Committee had recognized that it was something that needed to be addressed. So the agency really does need to tackle this because it's important to have that information to inform a good response.
In practical terms, what did the lack of that information sharing in this instance impact?
So what we saw, even though they hadn't reconciled or agreed on what would be shared and when it would be shared, they still shared information. So we definitely saw the provinces and territories and the federal government working well together to overcome some of those weaknesses and share that data. They, in fact, adjusted their requirements partway through the pandemic in order to ensure that there would be better response. But that being said, it really did slow down the agency's ability to gather that information and analyze it and have it inform and change the response going forward. So no one will really know if we were better prepared, if we would have had a different response, but we owe it to the country to be better prepared.
And what does fixing it require, or what did it require when it was first highlighted? Is this a money thing?
I don't think in the past when we highlighted it as a money thing. We highlighted it as coming together and collaborating with governments at other levels. Across our country, health is regulated provincially. Municipalities play a role in it. And so it's really about coming to a common understanding that collaboration is needed in a crisis. We saw it happen during this crisis, but we should be better prepared and have all that ironed out so that it's more responsive and more effective.
I guess what I'm trying to get at with that question is wondering where the gap is. So your office even identified it earlier. Other reports had identified it as well. Like why didn't it happen? Was it just a lack of political will? Was it a lack of investment? And I'm asking in the vein of like what can rectify it going forward?
Well, I think I would point to probably investment in IT infrastructure. I think that's a recurring theme that we raise in many of our audit reports. And here is another case. We saw that the infrastructure system at the agency couldn't support the volume of the data that was being shared. And it's important to invest in sort of those back office things in between crises and not to try and do it in the middle of one.
Okay, Ms. Hogan, I'll leave it there. Thank you very much for your insights tonight. Appreciate it.
Thank you. It was a pleasure being here.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.